Tonight,
I was on the back of Dad's motorcycle.
She had let go of him, and he looked in his rearview mirror and saw that her eyes had rolled back and she started having a seizure.
an ABC 27 special presentation.
I was really nervous, scared. I had no idea what was going on until I finally got in the hospital.
BRAINSTORM, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Neurological conditions are often brought into the spotlight by famous people. Actress Selma Blair recently revealed she was diagnosed with multiple sclerosis. Singer Neil Young has epilepsy, and singer Glenn Campbell had Alzheimer's. Up to 1 billion people in the world have a neurological disorder. That's about 1 in 6. And the leading cause of disability and death is attributed to these disorders worldwide. What are symptoms of neurological disorders? What treatments are available? What are some tips for caregivers? You will find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Hi, Christina.
Hi, Deborah. The phones are already ringing in here tonight. Specialists from Penn State Health, Milton S. Hershey Medical Center are sitting right here, and they're ready to answer your phone calls through 8 o'clock. Just call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Dr. Jen Argudo will answer your emails throughout tonight's show. All calls and emails are confidential, and I'll be back later in the show to share some of these questions with you.
Thanks, Christina. A Hershey woman thought she had the flu, but the symptoms kept coming back. Karen Hunt was desperate to find out what was wrong with her. Here's Karen's journey. 54-year-old Karen Hunt exercises 5 times a week. In fact, she's a fitness and wellness trainer for people with multiple sclerosis.
I do work with other MS people, other MS clients, getting them to hopefully see that with a lot of work and a lot of positive thinking, a lot of healthy eating, this can all be doable.
Karen speaks from experience. Doctors diagnosed her with MS 4 years ago. Initially, she thought she had the flu.
In January of 2015, one weekend, I had just become very ill. I had gotten vomiting and when I got vertigo, just very dizzy, which again, brought on the vomiting.
Karen's symptoms seemed to get worse, so she made repeated trips to the emergency room.
I was starting to have some trouble with my right eye. If I didn't have my glasses on, I would start to see double.
It's difficult because you want to help the other person, but you don't know how because it's really not clear yet what's going on.
MS is a complicated disorder to diagnose because symptoms can come and go. Sometimes you have a symptom and by the time you see your doctor, it's gone. Or sometimes you have a symptom and it looks like something else.
Another round of tests gave doctors a better idea as to what was going on with Karen.
We went through MRIs, CAT scans. This time on my MRI, they found a lesion, which can be, a sign of MS. So from there, they did more tests. We did a PET scan, we did a spinal tap.
So this is actually Karen's MRI. In the middle of your brain, you have these ventricles where there's spinal fluid. And we say that MS lesions are round or oval near the ventricles, often coming off perpendicular to the ventricles. And her MRI is actually classic for MS.
MS wasn't something that I even really knew much about because I don't have any relatives or any friends or anything that had MS. So I can't say I really knew anything about it.
I think it was a relief because we knew exactly what was going on, and at that point you can research and figure out what to do next.
MS is an autoimmune disease. So the symptoms relate to the brain, but the problem is really the immune system. So the immune system gets sensitized to something and confused and attacks the brain, attacks the myelin in the brain. Whereas it's supposed to attack bacteria or viruses, it's confused and attacks the myelin. So MS patients can get almost any symptom. They can get numbness or tingling or weakness. They can have low energy or memory problems. Some of them aren't as obvious.
And we talked about the possibilities of, medication, what you can do to help your MS, those types of things.
The long-term treatment to make their life better is one of the MS meds. And there's now 12 medications for MS.
At that point, I decided to go by his recommendation and go on an MS medication.
All of the drugs are geared towards calming your immune system down in a selective way so you can still fight infections, but you don't attack your brain as much. The whole goal of treatment is to prevent the next attack. So we try to keep them attack-free and they develop less disability over their lifetime then.
Karen may have MS, but she wants to make it clear that she is doing her best to control it instead of MS dictating her life. A strong message she hopes other MS patients embrace.
It's very rewarding to me to be able to work with other MS clients and be able to share with them, so when they say, oh, my right hand hurts, I can say, yeah, mine does too. And that's a good feeling for kind of both of us.
Karen, I think, is a role model and is able to give some people hope that they can follow in her footsteps and they can have that attitude and they can work hard at it.
She's really living her life the way she wants, which is what we want, and that's exciting to see.
It's the way I look at life, and I have this disease, and do I want it? No, but I have it. And everybody has something. And this is just what I have. And I've learned how to live with it. I've learned what I can do and what I can't do.
Well, I think she's doing fantastic. She has a great outlook. She loves life.
Karen has such a positive attitude. She hopes other MS patients will see how living a healthy lifestyle makes a huge difference. Joining us right now are MS doctors Gary Thomas and Carrie Twyman. Thanks so much for being here. Dr. Twyman, there's been a lot of publicity now. This has been brought into the spotlight because of actress Selma Blair saying that she's been diagnosed with MS. How do you get MS and what does it do to your body?
$1 million question. What we do know is that there might be a component of genetic predisposition, and then we combine that with external factors such as diet, location of where you live, maybe exposure to different viruses, things of that sort. The combination together will ultimately bring out the condition sometime during the patient's life.
And Dr. Thomas, why don't you talk to us about some of the symptoms that you have with MS?
Yeah, MS is very variable. Because it affects the brain, you can have a variety of symptoms. Weakness, numbness, tingling, cognition problems, fatigue, those are all very common. Bladder symptoms as well. This is a disease that affects young people, commonly diagnosed age 20 to 40, and it's a lifelong condition to work with. So finding a doctor that knows about MS and knows about the treatments is really helpful and helps them manage those symptoms.
And we do have some of those symptoms there listed on the screen, and that's certainly something for people to review, especially if you've had continual problems or problems that keep coming back. Now, Dr. Twyman, Pennsylvania ranks very high as far as MS cases. Why is that?
Surprisingly high. Well, it is a big state with a lot of people. It's the 5th largest state in population in the United States. It is the 3rd largest state population where MS resides in. It's about an estimate about 1 in 1,000 patients develop MS.
And I would say, Dr. Thomas, how has medication changed over the years, and what should patients look for when they're looking for a provider?
That's a great question. The medications have changed dramatically. First treatments were available in the 90s. We went from 1 or 2 treatments now to 12 treatments available, and the treatments are complicated and they can present some monitoring issues and some risks. So you want a doctor who understands them and knows how to write for them and monitor them and take care of patients. And we really wrap the medications around a whole lifestyle plan to get them to optimize their health.
And really sort of have a healthy lifestyle, eat healthy, and do exactly what Karen's doing, because she's a great example.
She is. We get all of our patients to exercise. We get them on an MS-friendly diet, and if they smoke, then we get them to stop smoking. And so it's more than just a medication, it's a whole lifestyle change.
Okay, doctors, thank you so much for this valuable information. And if you would like more information on the MS program at Penn State Neuroscience Institute, call 717-531-3828. Now let's check in with Christina Butler in the ABC 27 call center. Hi, Christina.
Hi again, Deborah. The phones just keep ringing here, and you can get your questions answered right now by calling 717-346-3333. Here to answer our viewer questions tonight is neurologist Dr. Will Jens, and here's our first question. My mother developed MS when she was in her mid-30s. I'm 21 years old. What are my chances of getting MS, and what can I do to prevent it?
So while there are many factors that go into whether you develop a disease, being your genetics, your environment, if you are north of a certain latitude or not, vitamin D development, but on average, people who develop MS with a first-degree relative such as your mother would be about 3 to 4%.
Okay. All right, thanks for answering that. We'll be back later with more questions. Again, you can call in and you can also email your question to questions@abc27.com. We'll be right back.
You're watching Brainstorm on ABC 27, sponsored by Penn State Health.
Welcome back. A Reading woman took a lot of medication for years to treat her epilepsy. For Samantha Hess, seizures became a way of life. An amazing device changed everything for her. Here's Samantha's journey. 22-year-old Samantha Hess attends Hiram G. Andrews Center near Pittsburgh.
It's a technical school where they do further training so that kids with disabilities are able to have a better opportunity in the job market. So she's interested in nurse's aid and or retail management.
At first I was really nervous. I was like, should I call my mom every day? But I was really nervous. It was pretty cool, and then I got some friends and hanged out with them, and then I wasn't nervous anymore.
Samantha is living her dream. She never thought it would be possible because of what happened when she was 13 years old.
I will never forget it. I was on the back of Dad's motorcycle. It was very scary with this seizure.
She had let go of him because she was holding on to him, and he looked in his rearview mirror and saw that her eyes had rolled back and she started having a seizure.
There was a car behind us, two of them. The one car that went by, and then the second car was with us because Dad pulled over and stuff and put me on the ground, and the car called 911. The person in the car called 911.
That was a grand mal seizure that she had at that time, and that was the start of the seizures.
I was really nervous, scared, shocked. I had no idea what was going on until I finally got in the hospital and people were telling me what was going on.
The first of too many seizures for Samantha.
She had so many when she first started. They were like 30, 40, 50 a month, so it really interrupted her daily life, our daily life.
The seizures affected Samantha both at home and at school.
Somebody had to be with me at all times at school. Had to be. School's rule. Even in the bathroom, I hated it. Just to make sure I didn't fall or didn't have a seizure or anything else.
Since then, she has had more and more and was put on different medications, throughout the years. And nothing really, the medications really weren't helping.
Then Samantha came to Penn State Health.
She has what we would call a focal epilepsy, which means her seizures arise from one or more distinct regions within the brain. So in her case, she appears to have two different regions of the brain, one in each of her frontal lobes. So she has some of her seizures start on the right side of her brain, in the right frontal region, and some start on the left side.
They told me about my seizures, and they're explaining like different medications and stuff like that.
When we first started seeing him, she was having many different types of seizures, but all day long. So she would have, a few in the morning, maybe a grand mal seizure, and then she would have a lot of absent seizures. She started to improve, but he was still searching to, have more success for her and get more answers.
Surgery was not an option for Samantha since her seizures came from 2 different areas of her brain. So doctors introduced her to a new device called Neuro.
The actual terminology to what it does is called responsive neurostimulation. So that means the device is actually responding to something. So it's sending a stimulus in response to abnormal electrical signals that we see in the brain. If it sees an abnormal signal, which is the start of a seizure, it can send an electrical stimulation to trying to stop or abort the seizure before it turns into something that's clinically evident.
He explained where he was putting it. He was putting it on the right-hand side. It looks very small, like a battery almost.
So this device is actually planted at the level of the skull, the battery pack, and then the wires are planted either on the surface of the brain or into the brain in the location where we think the seizures are starting. In Samantha's particular instance, her seizures were arising from the surface on both sides, so she had surface electrodes placed, these subdural electrodes.
We saw the decrease in the seizures, and then as he's turned up the level, they've now disappeared.
I was really shocked that it actually worked. I really was shocked. I wasn't expecting it to work right away, but it did. It actually did. When I started having a seizure, it actually stopped it. It actually worked.
Samantha hasn't had a seizure in 7 months.
It's so refreshing now to not have to worry about that all the time and to not have to be on guard every moment. It's just so nice to have her be able to experience life without having all those stops in between.
She has improved in many other ways. Her cognition appears to have improved. She is far more attentive, more focused on her tasks. She has become more independent.
Now she's up at the school and she has her private room. She's there, being very independent and, like a normal, young lady should be, and trying things out.
I can walk around by myself and nobody at all. Nobody. No teachers, no aides, nobody.
Samantha's done very, very well with the device. I mean, it's really significantly changed her quality of life.
I'm happy that I can do all these things by myself and I don't have to have anybody with me. Even at home, I'm actually walking the dogs by myself and I'm happy. I really am.
It's just been fantastic for her to have all that independence. So next thing is possibly getting her driver's permit, which she's always wanted to do, so that'll be great.
The Neuro device has opened so many doors for Samantha. She is truly happy. Another example of doctors giving Samantha the health she needs to live the way she wants. Now joining us, doctors Michael Sather, Jayant Acharya, and Tiffany Fisher. Thanks so much for being here. Dr. Acharya, why don't you talk to us a little bit more about what is epilepsy? We saw a little bit of it in Samantha's piece.
Epilepsy is a common neurological disorder that is characterized by recurrent seizures. It can be genetic or a result of various conditions such as stroke, brain tumors, head injury, and so on. The seizures themselves arise as a result of an abrupt change in the electrical activity of the brain. It can often be picked up on EEG. The clinical symptoms that patients experience during a seizure depend on the area of the brain that's involved. But in general, there are 2 main types of seizures. Focal onset seizures that arise in a specific region of the brain, such as the temporal lobe, or as in the case of Samantha, the frontal lobes. And the other type is generalized seizures, where seizures arise from both sides of the brain at the same time. And patients often lose consciousness, stiffen up, and jerk their entire bodies, which is the type of seizure that most people are familiar with. Thinking of seizures in this way, focal and generalized, is also helpful in planning treatment.
Okay, and that brings you into the picture, Dr. Fisher. Talk to us about treatment.
So luckily there are a variety of ways that we treat seizures, one of those being first and foremost medications. And as Dr. Acharya stated, we might try to treat seizures based on where they arise. So if they're focal versus generalized with our medications. If we cannot control seizures with the medications, which popular in the pediatric world is using a ketogenic diet. And here we try to restrict the consumption of carbohydrates and increase the amount of proteins that our patients are taking. Then, if that's ineffective, we might consider surgery. And with surgery, we're trying to remove that part of the brain in a focal manner that's actually seizing. And if that's ineffective, finally, we'll talk about using some types of devices with neurostimulation.
And that brings you into the picture, Dr. Sather, as a neurosurgeon. Talk to us about the NeuroPace. It has made a huge difference in Samantha's life.
So NeuroPace is a form of neuromodulation, which is using electrical stimulation to modulate the nervous system. So here with Samantha's device as a neuromodulation device, it's actually monitoring the EEG signals from the brain from surgically implanted electrodes. This is the actual device here. There's some electrodes attached to it, and it's recording EEG from the brain. And so when there's an abnormal electrical signal from the brain, the device can send an electrical impulse to sort of abort or stop the seizure before it becomes clinically relevant.
And how has this changed as far as surgical developments?
Yeah, so it really opens up another avenue of treatment for patients that have epilepsy that are not candidates for surgical resection. So first and foremost, the mainstay of treatment for patients that are medically intractable is usually surgery, but there's a group of patients that cannot have surgery. For instance, if they have seizures arising from an area that we can't safely remove, whether that be near a speech area or near a motor function area where it affects their movement, we can't remove those areas. So patients that have medically intractable epilepsy, that have focal onset epilepsy, where we can't remove something, this is a great solution for them.
Okay, lots of really good information. Thank you for being here tonight. And if you would like to find out more about the epilepsy program at Penn State Neuroscience Institute, call 717-531-3828. Let's go back to the ABC 27 call center. Christina.
Hi, Deborah. It's a busy night in here. And just a reminder, you can call 717-346-3333 to get your questions answered. The phone lines are open until 8 o'clock. And if the phone lines are busy, you can also send in an email. You can send that email to questions@abc27.com. We're back now with Dr. Will Jens and our next viewer question. And here is that question. They want to know, I'm 25 years old and I have had seizures for the past year. I've been on the same medication and it does not seem to work. Should I try a new medication?
So sometimes people will consider switching a medication. There is a risk to that. Sometimes your doctor might consider adding another medication, but once you start adding a second medication on for epilepsy, your chances of having good seizure control really start to drop. So with the first anti-epileptic medication, you can have maybe 60% good control, will have good control. Add a second medication, you maybe get another 10 or 15% will have good control. And after that, adding a third or a fourth anti-epileptic medication is really going to bring you 1 or 2%. So starting to consider surgical options such as the vagus nerve stimulator, the responsive nerve stimulator, which they were just discussing, or even temporal lobe resection is something to be considered.
Okay, great information. Here's our next question for you.
Okay, it looks like we're having some difficulty at this moment. Why don't we join right now by neuropsychologist Dr. Paul Esslinger. Thank you so much for being with us. Your specialty is Alzheimer's and also memory loss. Tell me, what is the difference between the two?
Memory loss is a relatively isolated condition of having some difficulty recalling recent events and experiences. While frustrating, it can usually be managed with some additional attention to writing things down and providing yourself reminders, and by itself is not disabling, and usually individuals can carry on their typical activities. Alzheimer's disease is a condition of the brain that causes cells to die off and progressively over time, and the brain shrinks in size. Alzheimer's disease is the 6th leading cause of death and has been increasing some 145% in terms of the increase in deaths since the year 2000. So it's a very serious illness that progresses to involve all of the brain and all kinds of cognitive functions over time.
Yeah, quite a difference. Now talk to me about some of the treatment options. How does it differ?
For memory loss by itself, we don't have any treatment options, though we do have one clinical trial of a medication patch going on now at the medical center, which looks very promising. So individuals can call and ask about that at the medical center. For Alzheimer's disease, there are 2 FDA-approved medications that can slow the progression of the symptoms, and that's very important. Proper diagnosis is also extremely important. There's also some lifestyle recommendations from the National Institute of Health that, if implemented, can cut the occurrence of Alzheimer's disease by 30 to 40%. That's things such as treating sleep apnea, controlling blood pressure, and controlling diabetes, for example.
Okay, and as far as resources for caregivers, because those are the people who really need some advice, what tips do you have for them?
So this started in about 2010 with Congress when they passed the National Alzheimer's Project, and they started to appropriate more funds for basic research. This has now filtered down to the states, and the Commonwealth of Pennsylvania has a state plan where they're now infusing the area agency on aging with more resources for caregivers and for patients. So that's a great place for families to start for in-home services, home health aides, Meals on Wheels, and other things like that. Another great resource is the Alzheimer's Association, and the Central Pennsylvania chapter has a lot of services to provide as well.
Okay, thank you so much for all that information. We do appreciate that. And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information, or if you would like to schedule an appointment with Penn State Neuroscience Institute, call 717-531-3828 or visit online at pennstatehealth.org/neurology. Thanks for watching tonight. We wish you good health.